I still recall that in 2023, when the goal of Viksit Bharat in 2047 was announced, a very extensive exercise had been taken up to identify what its elements should be. And I am sure Dr. Paul sir recalls that on the MyGov platform, lakhs of suggestions poured in as to what should be the elements of our vision. The government constituted sectoral group of secretaries. Niti Aayog was of course playing a very important role in coordinating the entire vision exercise. And it was realized that we need to work through convergence, and that's why I like that one of the themes in the current summit is convergence. So that's the reason why we had these sectoral groups working together. And during this exercise, of course, health was recognized as one of the foundational pillars for Viksit Bharat. And the goal that was set for all of us who are in the health sector was that we need to provide high quality, accessible and affordable health care to our citizens. And these goals that we identified, the roadmap for that is something that is being made. The roadmap is evolving through every budget webinar, through every pre-budget consultations for which NATHEALTH has been very supportive. We work towards further fine-tuning our strategies and our roadmap for achieving Viksit Bharat. A lot of youth connect is also being done because they are the people who will be leading Viksit Bharat for this initiative, and that really helps in a part of our goal, which is innovation. So the main action points that were on which we had to work was, one was of course, as I mentioned, affordability. Second was innovation, third was technology driven, and then fourth was high quality healthcare solutions. Some of the initiatives which we were taking have already been mentioned by President NATHEALTH, and many of these are also mentioned in the paper that has been prepared, which is really good because this shows that there is better convergence of ideas, and I'm sure both government as well as the private sector will benefit from that. So to ensure that affordable healthcare is there, I'm sure many of you are aware that there is a very comprehensive primary healthcare initiative that has been taken by setting more than 1,80,000 Ayushman Arogya Mandirs. And these Ayushman Arogya Mandirs are focusing both on health and wellness, and there have been over 480 crore patient visits in these health and wellness centers. The second part is the free drugs and diagnostic services. And I'm sure many of you are partnering with various states to provide especially the free diagnostic services. The number of tests in this entire network was expanded. So if you look at the free diagnostic services, 14 tests at the level of sub-centers, 63 tests at the level of primary health centers, 97 tests at the level of community health centers, 111 tests at the level of sub-district hospitals, 134 tests at the level of district hospitals. Why I'm mentioning these figures is that government is striving to expand the free diagnostic services initiative. Similarly, the free drug services initiative, the essential medicine list includes 106 drugs at the level of sub-center, 172 at the level of primary health center, 300 at the level of community health center, 318 at the level of sub-district hospital centers. Now various technological solutions are being implemented through the drug and through our various portals to monitor whether these drugs, whether these diagnostics are available. The health facilities across the country have come forward. Over 2 lakh have assessed themselves against the IPHS, the Indian Public Health Standards. We are striving to get the National Quality Assurance Standards in place. Over 50,000 public health facilities have certified themselves as meeting NQAS. So while we are trying to make healthcare accessible and affordable, we are also trying to retain the quality. You must have heard of the announcement, and many of you might be participating in it, to set up daycare cancer centers in all our districts. This was last year. We have the Pradhan Mantri National Dialysis Program. So 1,768 dialysis centers are reducing the out-of-pocket expenditure for patients across the country. The Pradhan Mantri Jan Arogya Yojana, of course, 36,164 hospitals are impaneled, of which a large chunk is in the private sector. And you all have been supporting this initiative despite many challenges. Third part, next we talk about digital transformation. As Ameera ji mentioned, the Ayushman Bharat Digital Mission has generated over 86 crore Abha IDs. And we really need to get it going. So I'm so happy that you have included it as a part of the deliberations in your summit, because continuum of healthcare records becomes important for each one of us. I mean, I'm great at misplacing all my records, so I don't know about everybody else. E-Sanjeevani, 45 crore teleconsultations are helping patients talk to doctors at our sub-centers and our primary health centers. They are helping doctors talk to specialists. So E-Sanjeevani has really developed as a very robust solution, which is being acclaimed across the world. Preparedness and resilience are the targets that we are trying to move through our Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. So this is the third time I'm using Ayushman Bharat. It's the third pillar of Ayushman Bharat, which is the Health Infrastructure Mission. For sharing with the participants here, we are constructing urban health centers, block public health units, which are laboratories at block level, integrated public health laboratories at district level, and of course critical care blocks, along with many other elements for strengthening disease surveillance and emergency response systems. So we can always sit down together and see how the private sector can contribute to this. Because of initiatives taken in the public health sector and by many of the partners here, our maternal mortality, as you are aware, has declined sharply by 86%, infant mortality by 73%, and under 5 mortality by 78%. The universal immunization coverage, which we are tracking through UN, has of course contributed to it, apart from a large number of initiatives focusing on maternal and child care. Yesterday was the World TB Day, and on this occasion we have launched the second phase of intensified TB Mukt Bharat Abhiyan. For this, we used AI analytics to identify 1,58,000 villages and wards which are high burden or high risk. And this time we are focusing on these 1,58,000. What really took the TB Mukt Bharat Abhiyan to the second level was the private sector notifications that added value to the whole exercise. So the drugs and diagnostics are fully sponsored by government, but people who go into the private sector, when you alert us, it is a very important step in TB elimination. The other aspect is, of course, supporting TB patients under the Nikshay Mitra Yojana. Government does add to the nutrition kitty by way of 1,000 rupees per day per month, but a large number of volunteers, and I'm sure some of you have also volunteered as Nikshay Mitras, who have adopted TB patients and providing them both nutritional support as well as psychosocial support, or encouraging the members of your organization or through you if we could do outreach for that. I would request all of you to just download or have a look at the TB Mukt Bharat app which got launched yesterday. So there are several measures that we are trying to take to ensure that we also have a e-mitra for the TB patient through this app. We had the Swasth Nari Sashakt Parivar Abhiyan last year, and many of you supported us in this endeavor. Of course, Guinness Book of World Records did recognize this initiative on several counts, but more importantly, it generated large-scale awareness about non-communicable diseases and vaccination, and so that really helped. When Honorable Prime Minister gave the clarion call to reduce edible oil consumption by 10%, many of you came forward to support this national effort to combat obesity and the prevention initiative. So for that I'm grateful, and I would like to request all of you to also examine ways to contribute to the strengthening the preventive system. I'm really like reading out a list of all the things that I want to say. So I do hope it doesn't read like a laundry list, but I just wanted to share all these thoughts with you. The antimicrobial resistance endeavor that we have taken up, I think you can suggest ways to how do we improve the outreach to that, because the situation is getting scarier. I haven't had a time to study the AIMS study which was reported in papers, maybe Dr. Paul would have, or some of you would have, which also says the effectiveness of blood thinners is going down. But what I mean is that as we are coming up with newer solutions, older solutions are not just getting phased out, are getting phased out because of things like antimicrobial resistance. So this is something that you can tell us how. We have a national antimicrobial action plan which we can always share. Some of you have participated in it, but your support for AMR would be invaluable. During the AI India Impact Summit, we launched the strategy for AI in healthcare for India, as well as both, which is the benchmarking open data platform in health AI, for proper testing and benchmarking of AI tools. So I would request those of you who are involved in research and in developing AI solutions, do help take us help us take forward Sahi as well as both, because these are the two initiatives that we have taken, realizing that it's very difficult for startups or other people who develop AI solutions to really try them out, get them vetted, and get them incorporated into the public health system. So I would request. This year, NATHEALTH also participated in the pre-budget seminar, and we have had a number of announcements for the healthcare sector. One is, of course, setting up trauma and emergency care centers in all our district hospitals, then strengthening mental health services, including setting up another NIMHANS in northern India, and strengthening of allied healthcare professionals. So I'm very happy that NATHEALTH has organized a special session on this. We have been given the absolutely very challenging target of 100,000 allied healthcare professionals in the next 5 years. So this is something which certainly government cannot do alone, and we do need all of your support for this. Regional Medical Hub has been announced. DPIT is taking the lead in designing this, but your inputs would obviously be key to how to go forward with this. Last year, government had announced that we have to step up PPP in social infrastructure, and a number of states have come up with projects for which they have approached Department of Economic Affairs for VGF funding. So I just wanted to flag this, that this is another sector which is now looking up, because government is giving the push for PPP in social infrastructure. Many of them have been cleared, and we look forward to seeing how they evolve. So indeed, when I looked through the theme of the session, the theme paper, I almost felt that I could hear you speak, your voice, it will really shape how these government initiatives can be taken forward, and for that I'm very grateful to all of you. I look forward to hearing more from this entire summit, and I will closely go through the proceedings. So do share those with me at the end of it, and I wish you productive and very useful deliberations. Thanks a lot.